Bom dia a todas e todos.
Good morning, ladies and gentlemen. It's an honor to be here, invited by the Forum in Health Innovation to be the moderator of the panel. We have with us
do Jia-an, vice-presidente sênior da BOE Technology Group. Vamos contar com a presença como debatedores da senadora Amelia Lemos, que tive o prazer de conhecer o seu trabalho de perto e quero atestar a qualidade, a seriedade com que os trabalhos foram feitos junto ao Senado, junto à sociedade brasileira, e também com o deputado Pedro Westphalen, que tem grande experiência no campo da saúde, ele é médico, da ciência, tecnologia e inovação, e que hoje está na Câmara Federal,
area of science and technology, and he's currently helping us by working in the Congress. I would like now to invite Professor Dr. Liu Jia-an to tell us about industrial development in China as a way to support our thought, our reflections, and propositions for development and innovation in health. It's a pleasure to be here. Now you have the floor, Dr. Liu Jia. Thank you very much.
Thank you very much. So I'm going to start my presentation in Mandarin. Thank you. Good evening. Well, I got it wrong. Actually, over there where you are, this is good afternoon. This is my daughter.
Say hello.
Say hello.
She's
going to bed. It's late already. No, now I will officially start working. Thank you very much for your time. I will not take very long in my explanation to talk about the progress of health in China. I will certainly talk about the changes we have implemented after the pandemic. If you can go to page 2 of my PowerPoint presentation. In China, we usually divide the history of healthcare, or the more recent history of healthcare in China. We divide it in 3 parts in terms of the use of the internet. We call it the history of internet in health in China. The first period is about the initial diagnosis, as we call it. And so this time was between 2014 and 2017. This is the initial time. The 3 main categories that you can see here on the picture: medical care, medicine, and medical insurance. At first, especially focusing on medical care, 12 government policies were issued in that period. between 2014 and 2017, and these policies regarded the initial exploration, and they were focused on medical care. And this was more about diagnosis and treatment. So there was an encouragement for the building of a third-party remote consultation platform to complement the offline channels. This allowed physicians to consult on such platforms as a part-time. And the most important aspect is that they could provide prescribed medications. And this was the main change between 2014 and 2017. The second period went from 2018 to 2019. And this was more about an explicit encouragement involving especially medicines and medical care. So, in medications or in medicines and in medical care, there were two major challenges. The online hospital was allowed, and also prescription, online prescription was allowed during that time. So in terms of equipment, it was allowed to sell medication in platforms during this period. And in the third period, after 2020, this was the main change. And it definitely was because of the COVID epidemic. After the country shut down, and we had a lockdown, so no one could go out from home. People weren't allowed to go to the hospital. So then, prescriptions and office appointments, everything was turned to the online platform. So there was a steady increase of online appointment in every insurance carrier. So, in summary, these three periods have been increasing and adding up policies. So the use of internet has become more and more prevalent in China along all these years. Now on page 3 of my presentation, can you see the page 3? On the left-hand side, there is an image, a graph. So it shows from 2020, from the beginning until now, it depicts the online demand. So at the beginning of outbreak, there was a surge in demand. And on the right-hand side, you can see the number of online appointments and the increase in online hospitals. or as we call internet hospitals. So because of COVID, we had an increase, and there was an increase in the speed of adoption of online hospitals and online appointments and online healthcare as a whole. And now going on to page 4, where we will talk about the internet medical scenarios for prevention and control of the COVID epidemic. There are 4 main phases. So first we need to understand the information, then there's a remote consultation or appointment, there's online purchase of drugs, and then disease management. And then, as you can see, we had 63% permeability or penetration in terms of understanding online information. But in terms of disease management, we only have 8% penetration, which is not enough. So what does this mean? So all through the COVID crisis and during the shutdown, and then the use of the internet or online healthcare. So at first people used it more to find information and then to buy medication. Well, then the population has already accepted that they can buy medication through the internet. They don't need to walk into a drugstore to buy their medications.
OK， 但是我们会发现，院外的慢病管理还是在跟互联网一样。
So as you can see, chronic diseases
它的潜力和空间十分巨大。
Are still very much in the beginning, so the growth potential is still major.
你好，能听见吗？OK， 我们进入第5页。
Now going to page 5.
为什么我们认为说这个院外慢病管理这个空间发展巨大？
So there has been a huge growth in demand for healthcare.
从第5页的左边的上面的图我们可以看到，中国医疗的供需矛盾非常的突出，而且长期。
In China, we can see completely different supply and demand, and this problem had been in place for a long time.
所以我们看第一个金字塔的话，3级医院
We can see the first pyramid.
相对最高级的医院，
different quality of hospitals. Here, the best quality of hospitals.
中国有2749家。
2,749 units specifically.
二级医院的话，我1687家。
Second level hospitals, about 9,697 hospitals.
11264家。
Basic hospitals, 11,264.
我们会看到，高等级的医院数量非常少，低等级的医院非常多。
We can see that there are very few good hospitals. Basic hospitals are much more abundant.
但是每年的诊疗人数，高级医院是20.6亿次。
However, every year we have many more visits in top quality, 20,000 visits a total
一级医院只有2.1
in top quality
2.3
hospitals, of course. Tertiary hospitals have 2 billion visits, whereas secondary level hospitals have 1.3 billion only.
这是一个。第二个的话，看执业医师的发展的增长数量。
Now let's see the chart on right where we have licensed physicians.
我们整理15年到2019年的数据，它的复合增长率只有6%。
We can see the CAGR has only grown 60% between 2015 and 2019.
那现在的问题是什么呢？我给大家做一个简单的说明。
Let me very simply explain what happens there.
我们在供给端，我们优质的医生资源不足。
We don't have enough good quality doctors in terms of supply side.
然后医疗资源分布不均。
We also have uneven distribution of medical resources. It's not well balanced.
然后，大家对高等级医疗的需求的增长没有办法满足。
And we have difficulty to meet the rapidly growing medical demand. Our needs had not been met yet.
那国家现在中国在做什么事情呢？希望
So what have we been doing in China at large?
分级诊疗以及互联网医疗的政策。
As a result of our online migration that I mentioned,
合理的利用医疗资源。
we can now better divide and share medical resources available in China.
但是从需求端，我们会看到几个突出的问题。
But we still have very evident supply side problems.
第一个，人口老龄化严重。
On the demand side, we have an increasing population which is aging.
中国65岁以上的老年人从2020年13个百分点到2035年
13% of the population is over 65. In 2025, it will mean 15% of the population.
老龄化现象非常严重。
Very clear aging of the population as a consequence.
然后，中国高血压的患病率达到了27.9%。
The prevalence of hypertension in China has reached 27.9%.
糖尿病达到了10.9%。
Prevalence of diabetes is 10.9%.
COPD 患病率达到8.6%。
Whereas the prevalence of COPD is 8.6%.
2010年起，中国医疗健康的支出占 GDP 的比例逐年增加，2019年达到6.6%。
China has always been growing in terms of expenses, and it has reached a very significant number. Medical and health expenditures.
现在中国的医院，按照现在医生的发展数量，按照高等级医院的发展数量，没有办法支撑我们。
Even though we have had an increase in resources, it's still not enough.
医疗需求。
We have a greater increase for medical services in China.
我们拿这个呼吸慢病、呼吸系统的疾病院外管理。
For example, COPD.
例子，我们认为它是一个非常。
Let's use it as an example. There's still a very increased growth.
我们整理了这种呼吸系统的传染病的 history， 从2002年到2020年。
If we analyze the data and the historical data from the area,
发生频率不断的上升。
We can observe that we have been experiencing growth throughout the years.
这种感染的控制和康复的救治，对我们国民经济和人民健康影响巨大。
From an economic perspective, this is all very important.
然后，新冠疫情带来新的一轮呼吸疾病院外管理发展的窗口。然后我进到第7页。
So let me now skip to page 7.
京东方在医疗医工事业的我们的愿景定位。
Billy, this is the flowchart.
然后我们要针对客户进行健康管理，院外的、院内外的健康管理。
What really matters is health management and health control of our customers.
增大这个数字医院作为我们的整个医疗的支撑。
We have technology to provide most of our services, this basic support.
工具和手段，物联网的健康管理方案。
Technology will always be our best tool.
然后第8页。
Now on page 8.
我们跟这个 Airleak 的话，已经在进行了这种呼吸慢病分级管理的方案和流程。
Here we can see how to manage COPD.
然后左边的话，这个图会看到中重度的患者应该我们去送到3级医院。
To the left, you can see the whole process and all the referrals to different levels of hospitals.
然后稳定期的患者的话，让他在家里进行这种管理，自我管理。
Stable patients may stay at home and be controlled at home.
轻度的患者的话，到社区医院去解决。
Mild cases can be covered by public hospital services.
新东方作为医疗解决方案的提供者
BOE is offered as the top technology service of this process, being a service operator for all the different processes of health.
作为我们的支撑。
Finally, everything is supported by hospitals.
然后我们这种解决方案的话，在国内的话获得的这种就是认可和奖励的话，我们就不说了。
This is a solution in China, as we have no time, so I'm not going to say anything about prices.
医院和相关的这种医疗机构
In summary,
愿意跟我们一起在合作和推动发展。
many hospitals and also the government has been using our system. And I'm going to sum up here just for time reasons. Just to complete on page 10, you can also see
那乔杰女士的话是这个工程院的院士。
Senhora Chao Jie, Miss Chao Jie. She's a member of China Engineering
在
Academy.
这次武汉疫情期间的话，她所带的团队对整个武汉的贡献
During
非
the
常巨
COVID
大。
pandemic, she had played a key role in helping us control the situation in Wuhan.
然后陈亚红主任的话，实际上是
Miss Chan Yahu
中华医学会呼吸慢病分会的慢阻肺学组委员。
She's a member of the Medical Association, and she also works with COPD.
我们在一起合作，在新冠疫情前早已经开始了 COPD 的合作。
And in fact, we've been working together even before the COVID situation with all COPD cases.
然后我现在具体的在一些社区的方案已经得到了政府的这种认可，而且给我们非常大的
And to sum up and to conclude, we were very well accepted by the community, the society, and the government.
然后我们希望跟这个 Air Liquid 的话长期合作。
We also want to work in the long term with them.
只有这种有长期愿景的大企业，持续的在创新解决方案上
The
投入的
companies
话，
that think in the
我
long
们才有
run
可能去推动整个事业的发展。
can really help us change our needs and also provide better care to our people.
但是希望不管是在中国、在法国，还是在巴西，还是在哪里
However, regardless of being China, France, Brazil, or any other country,
我们的医疗专家们，各位医疗专家们，对我们的方案多多指导，然后欢迎大家有时间
we
有机
medical
会的话，
specialists
在现
want
场
them
的话
to share their wisdom, their knowledge with us. I would like to thank. We did have some problems of connection, and I apologize on behalf of the organization. And we had a problem of connection, but still, I think it was a very good presentation, and we still have got time to share the Chinese experience compared to our own. And it always brings together the idea of innovation, industrial development, and access to healthcare. I would like to ask Senator Amelia and our state representative could tell us how can we bring together industry, innovation, and universal access based on the Chinese experience, also thinking about all the dilemmas that we find and face in Brazil due to COVID-19. Fundação Oswaldo Cruz, where I work, this is something really important. How can we develop technology that is accessible to everyone who needs it? Thank you very much for your presentation, Dr. Liu, and I would like now to ask Pedro Westphalen and then Senator Amelia. Okay, so please, State Representative Pedro Westphalen, you have the floor.
Thank you very much, Carlos. I would like to greet all speakers, my dear Senator, who's going to be a senator again, and Amelia Lemos. She's a national reference in healthcare. And I would like to greet the Health Innovation Forum for the theme that is so current, something that we are going through, dealing with. And I will try in a few words to give my opinion about what we're dealing with here in Brazil, because the pandemic started to decouple Brazil from healthcare, supplemental health, and all our needs and potentials. And we can see that Brazil is a country that is very big, and similarly to China, there are major hospitals that are very big hospitals, mid-sized hospitals, and small hospitals with different capacities to treat. So the technological advances are very important, but they need to get to the front end. So we need to rethink Brazilian health, and this is the theme of this forum. So much so that I am suggesting a group of Congress people to talk about 4.0 medicine, so that all the existing technology is made available to the users of the public healthcare system. And so this is based on 4 pillars: access, quality, and funding. There's no miracle there. So if there are hospitals with major capacity, not just because of the machinery that they have, but the people who work there. So oftentimes in Brazil we build near hospitals, but who's going to operate the equipment that is there on the front line unless we had telemedicine? So a country that invests so little in technology, Fiocruz is here. It needs to become more prevalent and more important. So we invest less than 1% in research and technology. So we need to invest more on research. So there is a lot of potential. We show the importance of SUS, of our national healthcare system. It is available everywhere in Brazil, but not with the necessary quality or the necessary capacity. So the innovation and technology needs to get to the front end. And we have a healthcare system, and they are major purchasers of services. And this needs to be made available to everybody. Genetic therapy has come to stay. We have robotic surgery with much more precise surgeries. We need to make ICUs work so that people won't die because they are in the ICU. Renewal, then there's telemedicine that needs to be regulated. Of course, you also need to improve education in Brazil. We need to qualify our students, our teachers. We need to education. We need to implement education to have better education. But in reality, the problem they had in China is the same as we have here. Highly complex services, mid-complexity services, and low-complexity services. And similarly to Brazil, China is very big. We have very similar problems in terms of making healthcare reach the most remote areas of the country. And it's difficult to provide good quality access. And so we are investing in industry. We need to invest and to make the government understand that SUS is the entire system. It's healthcare. It has responsibilities at city level, state levels, and federal level. There are rules, and they need to be very clear. And then we had the pandemic. They needed to implement respirators in sheds. Well, you can't do that. It's impossible. We need to have public-private partnerships with countries that are our friends. China is a major partner of Brazil. China is the big partner of Brazil. They invest a lot in technology. Yes? Can you hear me? Can you hear me? Yes. Can you hear me? Yes. Can you hear me? You can continue. We can hear you. We have some oscillation. And so I think that the pandemic has given us the opportunity and provided lots of work in the area of healthcare, and the possibility of us reducing the bureaucracy. And now Anvisa is slightly faster in certifying materials and medications. We can do what we did in some cases, that it's not based on research and innovation. We need to strengthen our industry, but not to close the market to foreign players. So here we were just about having ICU respirators built all over the country, but we do not have enough anesthesia drugs or muscle relaxants. So we couldn't intubate the patients. We couldn't do that because we were lacking supplies. So we need to invest in technology, on research. Those of you who know Fiocruz, Manguinhos, Butantan, you know that we have huge potential to invest a lot, but not enough is invested. And in parallel, we have the industry investing 17–18% of its funds in research, and the country as a whole less than 8%. And we want to have public-private partnerships. So we need to understand that the whole technology needs to be made available to the Brazilian population. We need to put aside our discriminations, and we need to understand that healthcare needs a large share of the national GDP. It goes to health. Just to give you an idea of numbers of healthcare in Brazil. The airport, the main international airport in Brazil, 50% of the cargo is related to health, and this is not handled with the due care or priority. And that our distributors, industries, the doctor, the hospital, nurses, education of our healthcare professionals, the validation of the certificates. So this is the time for us to rethink. So we had a refunding that pays for productivity. So you need to do more in order to get more money, when actually we needed to pay based on quality, what is given back to patients. So someone has a fracture, they get to the hospital. If the patient is discharged without infection, they need to be rewarded for the good quality. So this combination between public and private healthcare is very important, and innovation and technology is important. That's why we have this group of Congress people, which is Medicine 4.0, to be made available in the front end, on the front lines, to every user in the country. And this is... And how much longer do we have to talk? And I can't hear you. Me neither, can't hear him. I'm sorry. Yes, I muted myself. You may make your conclusions for another 2 or 3 minutes, okay? So I think that today in our Congress, Senator, there are some congressmen who know about health and health care, are familiar with the problems. And then we need to expedite some parts of the national health care system. For example, Conitec. Conitec needs to be modernized to become faster, more agile. It needs to become more efficient. So we have many problems in Brazil, and one of our main problems is bureaucracy. We need to allow companies and industry to go into the system to contribute. They want to do that. We need to make it get to the front end with technologies and innovation, get to the front end for every Brazilian. And then you can save if you make it get there. And so you're going to reduce length of stay, reduce the cost for patients, fewer hospital admissions. It's much cheaper to have an efficient system rather than admitting a patient 20 times a year. And another important thing is for significant chronic diseases. For example, if you have severe asthma and use something that hasn't been approved by Conitec, they would avoid 20 admissions a year. So it's much cheaper. If you treat cancer and you cure patients straight away, they're going to be working and contributing to community. They will not step out from society. I think that the pandemic has left a legacy, has taught many lessons, and we are working in order to depoliticize the healthcare industry. We need to incentivize, to strengthen some points, and I'm talking about research and innovation. And I'm really obsessed with Fiocruz, our institute, and Biomanguinhos, and in TechPac in Paraná, Butantan in São Paulo. It's important right now for the government to participate in public-private partnerships, not closing ourselves to the international market. Congressman, I would like to thank you very much. I would like to thank on behalf of Fiocruz for your being here. It's a great pleasure to hear this recognition to our institute. Fiocruz has a very important partnership with the manufacturing industry, and to have this vision of a state policy for healthcare, something in the long term, so that we have institutional stability. Thank you very much for your kind words, and I would like to give the floor to Senator Amelia. And the floor is yours. It's in our hands. It's in our hands. Yes, greetings to you. Thank you for the participation. Thank you. Thank you very much.
Thank you, Carlos. Very good. I thank you for your participation. Also, Pedro, I'm just going to add a few comments to someone who is quite familiar with the Congress and also hospital area and healthcare at large. Especially because you, being a physician, understands about the pain of patients. I would also like to greet you for creating this Congress initiative to deal with innovation and come with a fine-tuning for healthcare in our country, which involves the private and the public sector. I think it was a very good idea to bring a specialist from China, very well-known specialist. Greet him for his great daughter, such a beautiful girl. I'm sure she's as intelligent as her father is. And in his report, we've heard that the problems that China has experienced are not different from problems that other countries, including Brazil, have experienced during the pandemic. Nobody was expecting such a hard hit and also identifying a new virus. China had the virtue of very quickly and faster than other countries come up with a solution in a country with such a huge population. Using technology, China started offering online visits, online hospital care, online purchase of medication. And to some extent, we did the same here in Brazil. And now we expect finally to have a vaccine as quickly as possible to protect us all. I think that the Chinese government is, of course, very strong in the whole system. In Brazil as well, because we have our SUS, our universal public health care system, but we also have an independent private service. So what's the difference in terms of supply and demand in China? We also have the same problems in Brazil. But in China, I don't know if it's lack of resources or lack of funding, or whether it's a problem of infrastructure. In Brazil, we have had some mismatch that got deeper a long time, because today the medical hospital, medical devices industry in Brazil was very much shaken. China started producing facial masks, respirators, ventilators, everything that was needed, because it had the capacity to produce it at more affordable prices than the international market. So the whole world depended on China to receive the supplies at first. Brazilian industry produced gloves, facial masks, so then it received the demand from China. But we didn't have the right conditions to manufacture it in the beginning of the crisis. Now, our Brazilian industry is much better organized, and we are manufacturing our needs. In terms of technology, the pharmaceutical industry plays a very important role. So on the one side, we have public, private infrastructure, research centers, and also materials, medical devices, hospital devices, as well as medication, where the pharmaceutical industry plays a key role. We also have a problem with sedative. We had to import sedatives from Uruguay and other countries to meet the demands that increased very quickly due to the pandemic. I think China serves as a very important reference, the most important one, the focus of this forum, which is innovation and technology. Without them, we cannot move ahead. So I think innovation has come to help us move ahead, to provide to users better clinical analysis, a medical visit, a purchase of a medication, and everything done much more based on technology. In China, there are televisits, teleconsultation. They sell medications online. And I would like to know from Dr. Li, when he talks about virtual purchase, is it delivery? Is the agent brought to the patient's home, or to the consumer's home or patient's home? This is something that I would like to hear from you, if you may. And when you talk about online hospital, how does it work? Because here we have telemedicine, right? Teleconsultations, televisits, but it is limited to just one visit, one medical visit. When you talk about online hospital, what is offered remotely or virtually? Of course, problems are very alike throughout the world, despite our differences considering China and Brazil. The pandemic also has to awaken in us a sense of cooperation, of fraternity. We have to work together, all our organizations. Fiocruz here in Brazil, a very important agency, Instituto Butantan as well. There are also a number of centers of research and technology in all the different states in Brazil. the pandemic for the University of Caxias do Sul here in Brazil, they developed a different respirator, and it was approved by our health regulatory agencies. So you see, from the need, they innovated and came up with something new. So crises, they generate opportunities, right? And the more we can benefit, the faster we get adapted to the new reality. The Brazilian Congress has a very important role to play, even though we've created a special committee just to address that. We have to move on with these initiatives. And I would like to really greet the initiative of Representative State Westphalen, because it's a way of guide our decisions. Thank you very much for the opportunity, and I hope my comments have been useful, because healthcare needs really more institutional support, more political support in Brazil, and we need a better players. We have the universal healthcare system, and many things can be done using technology to provide better care to patients. Fewer resources, providing better care, giving more results once they are all properly managed. So that would be a good way of summing it up. Thank you very much, Carlos. Great, thank you, Senator, says Carlos Gadelha. Yes, there had been the president, the CEO of my institution, has emphasized how well you've interacted in a number of forums. I think we've heard from the senator some elements concerning online hospital and virtual purchase of medication. And there is also another question about the release of resources for funding, for money, budget for science, technology, and health. Because in Brazil, those resources are just limited to a small amount. So let me hear from you, Dr. Liu. What is the Chinese experience on these two elements asked by the senator? So virtual purchase of medication, how it's done, the online hospital, and if you can please tell us something about funding, about budget to innovation and technology in China directed to healthcare. Okay, is it clear, the questions? You can feel free to answer the questions now. Thank you. Could you hear the questions? Would you like me to repeat the questions?
Can you repeat again?
Yes, sure, I can repeat the questions. One first question is about the online hospital. What is exactly an online hospital when you describe it? A second question, you talked about purchase of medications online. Were these drugs delivered to the home of the patients or not? And finally, money, budget to science and innovation in healthcare. Is it clear now?
好的，我试着去说明一下。
Let me tell you a little bit about such complex questions.
首先，这个互联网医院是依托于实体医院。
An online hospital is an online platform, and the hospital is integrated with it.
它在 hardware 和在 software 上，包括行医机制上需要国家的授权。
It all requires a government alliance for hardware and software to be fully integrated.
比如说，有专门的人员去负责运营这些互联网的客户。
For example, there are some specialists that analyze the patients who are seen online.
然后的话，它的这种购买药物的这种物流的话，实际上它
The process of medication purchase It's not a platform of the hospital. It's a third-party provider.
比如说京东 JD.com。
For example, Tingtong, which is the Chinese company.
就 JD.com 和阿里巴巴，它有它自己的物流系统。
Alibaba is another Chinese company. They have their own logistics system.
没有疫情的情况下，他们会送到家。
And without the pandemic, they normally make home deliveries.
然后承诺是在几个小时，4个小时到5个小时之内完成。
And then afterwards, they promise that they will deliver in 5 hours, no later, the medication.
疫情的情况下，他们会指定
During the
送到指定的地
pandemic,
点，小区的指定地点。
they deliver the goods on a given address in an area, in a district.
然后病人到那个很方便
And the
的指定地
patient
点去取。
then can, in a very simple way, go get it in a certain place. So they deliver to a certain place of the neighborhood, and the patient goes there to get it. So usually, if it's a major building state with many different buildings, they deliver to the gate.
这样的话就避免了这个送货员和患者之间的接触。
In this manner, the carrier and the person who has the disease will not get in contact.
这里边有一点我们需要重点的
And
介
there
绍
is one point which is important that I would like to explain.
在 shutdown 的情况下，因为
During the shutdown,
不管是武汉还是中国其他的区域，
in Wuhan or in other areas in China,
大家患突发疾病其实特别少
people。The disease
特
comes
别需要
unannounced.
互联网医院支持的是哪一些人呢？
Who are the people who
是有那
need
些
online
长期的慢
services?
性病的患者，往往都是老人。
Actually, are the people who have chronic diseases, elderly people.
因为他长期服药，他的处方一直不会发生特别大的变化。
Because these elderly people are taking medications all the time chronically. And this is not going to change their disease greatly.
但是不能够中断。
But it's impossible to
所以
have
他的
new
处方开
appointments
具比较简单，
for them.
就是 copy 以前的处方就可以。
But the prescription is actually simple. It's a simple prescription. It's just a copy of the previous one.
然后，
And then
如果有其他的不舒服的情况，
there are other health problems
他就
or
在线咨询他的医生。
they may go online and have an appointment
也可以打电
with
话
their doctors. They may call.
WeChat 方式去获得信息。
We use WeChat, the Chinese WhatsApp.
所以在中国，老年人除武汉以外，老年人有慢性病的这些老年人，死亡的人数大大的下降了。
And there has been a major drop in mortality amongst the elderly in China.
我不知道能不能回答您的这个提问的问题。
I don't know if I have answered your questions.
Sobre o recurso, pergunta do recurso para a ciência e tecnologia. Quem é se o governo libera
So your
sempre.
government,
Has your government been investing in technology? What are the funds that you have available for technology in China? Does the government invest in research and technology?
Hello.
Could you hear the question? Yeah, the question concerns funding for research in science and technology. Can you tell us something about that in China, please?
The first point, the country in terms of research. And then hospitals develop infrastructure. And the companies have a major participation. While actually, in most cases, companies implement the change.
Alibaba, JD.com.
For example, Alibaba, JD.com. And other logistic companies or internet companies. They work intensely on logistics. Building a bridge for hospitals and patients to be connected.
Eu queria agradecer as respostas.
I don't know if in a translation you got the infrastructure, technology infrastructure, but we could understand. Now, I am going to give the floor to the senator to close our debate, and once again to thank you all very much for your presence here today. Dr. Carlos, I would like to greet you again, to praise you for the Health Innovation Forum, and especially this idea that is very timely of integrating the systems, private, public, all industries. So our country is a federation, and it's important that all instances of the federation, states and cities and the federation and the pandemic provided us an X-ray of our deficiencies and what we can do to advance in oncology and many other areas, also looking into research and science, which is one of our main needs, because we have organizations and very well prepared staff, highly qualified staff, the best ones in the world in every area, Fiocruz, Butantan, and TechPar, and in my state, in the south, the same. So we need to encourage organizations to continue manufacturing for the benefit of the Brazilian population, also to integrate the political system, the National Congress, so that they have, because they play a very important role, and to share with countries such as China, Europe, United States, whoever, so long as there's something that we may learn, improve, and so that we may also offer to these fellow countries in a multilateral or bilateral cooperation relationship, everything that we have attained in this during this time. Our healthcare system is recognized all over the world, but we still need to improve. And here and in China, demand is greater than offer. Dr. Carlos, thank you very much for the invitation to the organizers. I would like to greet our expert and his daughter, who has gone to sleep because it's too late. I have been in China. I have been in China a few times in 1984, 88, and 2002. So I could see a little bit of the evolution of this country in its major challenges. So thank you very much, Dr. Liu, and I wish you all very good work and a very nice week. I would like to thank you all very much. I have the president of the Health Innovation Forum, Dr. Josia Villar. So cooperating is good for your health. So this is our takeaway. And then we can advance on this agenda. Thank you very much for your participation, and we're together in this. Thank you.